A genetic counselor is a healthcare professional trained in both medical genetics as well as counseling. And we work in a variety of fields, but here at Invision, my specialty, my focus is on cancer genetics. A cancer genetic counselor takes into account both an individual's personal history of cancer, the family history of cancer, and really does a risk assessment to see, are there clues present that may indicate that there's a hereditary cancer condition within that family. Typically, what I would do is do a medical history. Then I would take a family history looking at both mom's side of the family as well as dad's side of the family with a focus on cancer, meaning if an individual was diagnosed with cancer, what type of cancer it was, and at what age that individual was diagnosed. And then looking at the full picture to say, are those clues that tell me that a hereditary cancer condition is present there? And if so, what genes might explain that family and personal history? From there, we would talk about genetics, genetic testing options. And really, what I like to do with those patients is give them all of the information that can help them make an informed decision about which test best suits their goals and their needs. A patient would be referred to genetic counseling by their primary care physician or somebody within their healthcare team. And usually that referral is based on certain features within that person's personal history of cancer or their family history of cancer that qualifies them for testing for one of these hereditary cancer conditions. Some of the clues that might be present in an individual's family history would be a rare cancer diagnosis. So for instance, if an individual has a first-degree relative, meaning a parent or a sibling that has a diagnosis of pancreatic cancer, they would meet criteria for genetic testing. Or if there was ovarian cancer in a first or second degree relative or in that individual, then they might want to consider genetic testing. Some other clues that we look for are the same type of cancer or related cancers in multiple individuals on one side of the family. So let's say on dad's side of the family, there are 3 different individuals diagnosed with breast cancer. That would be an indication that there might be a hereditary cancer condition there. Or on mom's side of the family, same thing. Or let's say on mom's side of the family, there's a history of colon cancer and uterine cancer. That might also indicate that genetic testing could be an option. A patient coming into Invision Sally Jobe for genetic counseling really has the benefit of seeing a genetic counselor here, and we would take the time to really discuss all of the pertinent information that they would need in order to make an informed decision about that genetic testing. But let's say that they came back with a higher risk for breast cancer. Well, we have a high-risk breast program here at Invision Sally Jobe, so I feel like those patients could really benefit from that program because they would be in good hands with individuals that know how to screen and manage somebody with a higher risk for breast cancer.